morning we have with us Professor Porpiglia, who is Chief of the Department of Urology at University Hospital of Orbassano, Turin, Italy, and Director of the Residency Program of the University of Turin. He pioneered laparoscopy in urology and now is one of the top robotic surgeons in the world. We are talking together with him about the surgical technologies today available to improve precision surgical oncology in kidney cancer. So Professor, which are the available technologies that you use in your clinical practice today?
Okay, thank you so much, Dr. Bertolo, for this introduction. So we introduced a lot of technology in the last years. After the introduction of the robot, I think that we have more technology that can be combined with the robot, like, for example, the color-guided surgery and the image-guided surgery. So this new technology, I think, that improves the quality of our surgery.
Thank you. So do you feel that it is enough that urology handle this kind of technology, or do you feel that it's important to embark in your team other figures important for these technologies?
Yes, I think yes, because the urologists alone are not able to use to imagine the potentiality of expansion of technology. So for this reason, I think that in the next future, we need to work together with the engineers, with the radiologists, etc. But I think that these new figures are essential, these new professionalities are essential for not only for expanding the technology, but as well for introduce new technologies in the management of our disease. And so I think that the new team should be created, the board should be made by urologists, bioengineers, and other type of engineers, because we need to expand more and more.
Okay, we have enjoyed very fancy images from the published video articles, papers available on the literature of your surgical experiences, but which are the clinical advantages that you see with adopting these technologies during your practice?
So in my daily practice, I introduce a lot, as you know, the 3D reconstructions for the 3D modeling that we import inside the robot. So we have created the new methodology of operation, like augmented realities, and this is not the play, but this is not the technology, they have not influence in our results, but they have a lot of influence in our results. The outcomes that we carry out are essential, because we notice that we improve a lot the oncological results, but in the same time we improve a lot the functional results. So the creatinine, the functional results after partial nephrectomy, when you use this technology, it's better than the standard technology.
Fantastic. And which are the future perspectives? So do you believe that this kind of technology will be limited in the hands of a few experts at referral centers, or do you feel they will have the potential to get widespread diffusion?
I think that in the next future, after the experience that we have matured in the last years, will be more expanded. So we can divide the center into different types of centers. The center can utilize the routine technologies, and there are other centers, like my centers, in which we do development of technology. So, for example, now we have the possibility to utilize 3 different types of generation of 3D reconstruction: the first generation, the second generation, third generation. And so this is the result of our research. And now I think that we can offer that our colleagues, the second generation, because it's already approved, but in the same time it's already experienced in our daily practice. For the next generation, we need to test and to do new research in order to improve, to establish it, if this technology can be utilized routinely in our daily practice.
Thank you very much for your wise word and experience.
Okay, thank you so much for the interview.
Bye-bye.
Thank you.